Oh, never heard that before. All right. So, uh, Tate, if you, I think I made a little bit so you can share screen. So if you
Yep.
take it away.
Good. Can you hear me okay? Good. All right. Excuse the background. I just moved into the house and we're painting everything. So this is not my wall color, but all right, we'll start sharing my screen so you don't have to look at that anymore. So my name is Tate. I am about to graduate from Des Moines University. I'm starting residency down in San Antonio, so I just moved, and I am presenting the WMS water purification guidelines. Everybody can see okay? All right, we'll get going. So this was quite a dense topic. They went through pretty much every water purification method. So I really narrowed it down to kind of like the top, the best of the best methods. But look, feel free, they kind of addressed anything that you could think of when it comes to water purification. So refer back to all 21 pages of that if you want to look for it. But this is just the overall view. So to start, when do you treat water? Pretty much all these recommendations were 1A, particularly if you're in the wilderness and if you're, you just have to consider what's upstream from you, right? So if there's any kind of livestock or considerable human activity upstream from you, that's a great time to treat your water. The only one was 2B recommendations if there's no evidence of domestic animal or little wildlife, but I don't know how you would know that for sure. So I think what I took away was essentially, if in doubt, just treat your water when you're in the backcountry. When you're traveling internationally, especially to developed or undeveloped countries, that's also 1A recommendation. And then during natural disasters, when kind of the public water, drinking water sources could be contaminated, that's also a great time to treat your water. So that is when to treat, and then how to treat. Oh, okay. How to treat. So I've heard water purification lectures multiple times, and I think what I always get caught up on are the terminology that we use when talking about water purification. So here's just some distinctions. It's pretty like minutia, but purification actually refers to kind of the taste and the color and the odor of your water. So when we say water purification, what we really mean is like water disinfection. So we're addressing those like enteric bacteria, the protozoa, and the viruses that can make us really sick. Clarification is just like clearing your water. It just refers to the turbidity of your water. And that's really helpful before other disinfection methods. So those are three of the basic terms that we use when we're talking about how we treat water. And I thought it was interesting that disinfection really doesn't address chemicals like pesticides and things like that. And that wasn't also really addressed in the WMS guidelines, but just something to keep in mind if you're camping near a farm, I guess. So here are some clarification methods. And again, this just refers to the turbidity or the clarity of your water. There's something called adsorption, which is not absorption, but it pretty much is like a magnet is how I think of it. You use activated charcoal or this GAC in your water, and it kind of makes all the particles and kind of glob on to that charcoal, and it inactivates chemicals, which I thought that was really interesting. And it's great for after other treatments like iodine and chlorine because it can address some of those aftertastes that are common to those treatments. Sedimentation is only a 2B recommendation, but better than nothing. And that really refers to like the big particles that you can see, so like your sand. And also protozoan cysts, if you leave it for long enough, those will also settle. So they recommend kind of leaving your water for over an hour, at least until you can see things settle on the bottom, and then kind of just decanting that water through some sort of fine filter, like a coffee filter or even a bandana, and just drinking that. And then coagulation of flocculation. I actually hadn't heard of this, but it's using alkaline salts, and it kind of causes coagulation of the particles in your water. So you shake it pretty vigorously for 1 to 5 minutes, and then you let it settle. And then similarly, kind of just decant that through some sort of filter. So those all address the clarity of your water, and then you have to combine it with some sort of disinfection method. So here, the most common disinfection ones, obviously we all know about heat. And this is a great one because it's fairly easy no matter where you're at. There is a myth surrounding this that you have to boil your water for at least 10 minutes. And that kind of stems from some kind of varying, I guess, definitions of boiling. So if you consider boiling like just the tiny bubbles on the bottom, like I do when I'm boiling my pasta, that's not boiling. Boiling is like the rolling boil, and you just have to boil your water for 1 minute at a rolling boil. Even if you're at altitude where the boiling point is lower, that is still hot enough to kill everything that we are concerned about in just 1 minute. And that should be sufficient. Ultraviolet light, I thought was interesting. The thing with this is that you do need to clarify your water beforehand. So obviously it's a light source. So if you have really turbid water, it's not going to work effectively. So you have to clarify your water. This is a SteriPen that I found at REI. I don't use it personally, but it's $119. And I've heard it is susceptible to breaking. Obviously it's a device, so something to consider. It's also very expensive, but it is nice because it's reusable, it's fairly small, and it can treat a lot of water, which is important. But it does, depend on the duration you leave it in your water. It depends on like your volume of water. So there's a lot of factors to consider there. Then filtration, this one is also very common in the backcountry because products like the Life Straw and even the Sawyer Mini, and these are ceramic filters. And you can buy them based on the pore size. So protozoa and cysts are fairly large, bacteria are a little bit smaller, and then viruses are tiny, tiny. So really with these filters, we can filter out most of the protozoan and the bacteria, but the viruses still get through. It's usually, I think with a 0.2 micron size pore, you get like 87% of the viruses removed. So it's not 100% with the viruses, but it's still better than nothing. And since they are ceramic, usually they're very fragile. So sometimes they can crack or they can clog, especially if you're, drinking straight from a source. If you don't clarify your water beforehand, they can clog pretty quickly. So definitely bring a backup source or, clarify your water beforehand. It's important. Then there's chemical methods, and these are also very common because they are kind of small, they're easy to use. You can treat a lot of water with them. Chlorine dioxide or aquamira is common. The WMS guidelines noted that with chlorine dioxide, there's usually a long contact time required, and they mentioned like 2 to 4 hours, which is a long time to wait for water. But on aquamira's instructions, I think it only says like 30 minutes. So there's some discrepancy there. And you also do need to protect your water from sunlight after you treat it. So like the Hydro Flask water bottles are great, but Nalgene's probably aren't. And then there's the halogens like iodine and chloride. I think we've all heard about these. There are some residual tastes that are left in the water after you use these, but if you add vitamin C quite a bit of time after you treat your water, it can eliminate that. You do need to be careful with iodine use, especially in people with thyroid disorders and pregnant women. So the WHO recommends it in short-term emergency use only, but chlorine, they had no restrictions on that. And then chlorine, they do recommend in natural disaster instances, and they recommend 3.75 milligrams per liter of household bleach for 30 minutes. So I don't know how much 3.75 milligrams of bleach is. I tried to look it up online. Some people said it was like 1/8 of a teaspoon per gallon, if that's more to your liking, but maybe look that up before a natural disaster, I'm not sure. And with these two, you do need to consider the contact time that you're treating these, and the temperature of your water can really affect how quickly these can treat your water. And then, this is a summary, kind of going over all of these things. The general rule of thumb when I was going over this was just combine two methods when you're treating these, and you should be pretty good. So most of the time it's combining filtration and halogenation. Heat is kind of the one-step shop, as long as you kind of clarify your water before that. And then clarifying your water prior to a halogen treatment or even a filtration treatment is really helpful for both of those. And then in disasters, the hypochlorite, which is just household bleach, is the simplest because your water is probably already filtered. You just need to kind of disinfect it. And then really they harped on hygiene. So, these address things that are coming through your water, but also like washing your hands, digging cat holes, like just making sure your camp hygiene is up to par is really kind of the first line treatment in a lot of these things. And I thought this was a great summary table that I like to include. Summarizes, for the major treatments, and then most of the things that we're trying to get out of our water. So that's again, that is a 21-page document kind of summarized into one night. So if anybody has any questions, please let me know, but that's all I got.
Any questions or comments for her? Like she said, it was a dense one. It was a lot.
Yeah, it was good. There's a lot of good information. And I should say, for each one of the, for clarification filtration, they also had kind of like a improvised section where they went through some, either like myths about, how other people do that. And none of them had great recommendation classes, but it was kind of just interesting if you got into a pinch. Interesting.
I do have one quick question, if you don't mind.
Yeah.
I was just curious on the chlorine, why they needed to protect it from sunlight. You're mentioning the hydro flask, just how we use like UV and sunlight for this. I was wondering if there was a reason that you were aware of.
No, I'm not sure. So that was something that was mentioned in the WMS guidelines, that you needed to protect it from sunlight. And then when I went on to Aquamira's website, I saw that they had a bunch of like hydro flask looking water bottles, and I thought, oh, that's interesting, but I didn't see that they had mentioned anything, and I don't know if it's on their packaging or something like that either. But I'm guessing it's probably something about like some unstable compound. Who knows?
I'll try and look that up so we can explain that later. Well, then during the next presentation.
Yeah, that'd be great.
I'll try.
I can briefly look too. Thank you, Tate.
So I think, Drew, you ready to go next? All right, we're gonna have Drew go unless there's any other questions, and then I'll show the recorded presentation of the other article. So you should be able to share screen when you're ready.
Hey, Justin. So it looks like sunlight effectively reduces chlorine by 90% efficacy in just 2 hours. And that's why you have to keep adding chlorine to your swimming pool.
Cool.
I have the SODIS, the solar disinfecting of water. And so far it's a small group. This was back in 2014. Yeah, 2014. The premise was, the UV steri pens, we can UV cleanse water, but the point was for we'll call it a resource lacking environment, was sunlight an option to reduce contamination in water. Limitations they explained in here was their sample size was small. Their introduction, they talk about the various transmissions of UVA and UVB through more commercially available water containers, your clear Nalgenes, your tinted Nalgenes, your proprietary Nalgene technology. I have a bunch of opaque Nalgenes, so I'm out of luck here. And their methods were they took, in their words, a not substantially contaminated water source when they were in Costa Rica, of which they say the limitations were cloud cover, length of daylight you had exposed to. The setup is a black tarp, let me put here, a black tarp, a black background, a silver tarp, and these are various water bottles. We'll say one of those is a platypus, several are either proper Nalgene, knockoff Nalgene, or locally available water bottles. And per their words, this water was not horrifically contaminated to begin with. Pre and post, they did demonstrate that with several hours and up to 2 days, depending on cloud cover and your latitude, that was a legitimate point that pointed out that this only works in, we'd call a tropical latitude, but not the Goldilocks zone of north of the equator, but not on, due to humidity and cloud cover, but far enough south, I want to say it was Santa Barbara, California, or south, was usable. More south you got, the more humid it got, and the less it worked. They took samples of their water pre and post treatment. They left these out for several hours. And really the only thing they were able to measure was E. coli. They point out that while this does appear to make it safely drinkable, they were not able to measure any cryptosporidium, any giardia, anything else aside from the E. coli. They were able to plate and grow after the fact, both before they treated the water and after they treated the water, and all the various bottles. They did not have any ability to test for other contaminants, and also they comment their source was not tremendously polluted. The point is that if this would be a viable option to pursue for a larger scale investigation, because the requirements are minimum. As long as you have something that transmits, that holds water tight, transmits enough UV rays. They were talking about A and B, and the lack of transmission in various PET, Nalgene's proprietary stuff. If you had something that could transmit the UV rays to the water, this would be neat to chase down and see if, because you don't need mechanical filtration, you don't need chemical decontamination. It's sunlight and a roof, and about everywhere's got that within their parameters of latitude. Small sample size, but it's and only talking about the E. coli. It's an interesting thought, but I don't want to find out about the giardia.
He kind of touched on the limitations already, but what do you all think of the methods in the study used in the sample size? Anybody besides Drew?
Yeah.
All right. So basically they did 2 separate days in a low contaminated water source, only able to measure E. coli growth on an agar plate. They're using like knowledge from a prior study, basing their study on that. So prior studies have shown efficacy in other bugs, but this one is only able to check for E. coli. So E. coli is very common. It's high up there in your cause of waterborne diseases while you're backpacking and hiking and anywhere outside, or other countries, romaine lettuce if you're going to Chipotle, things like that. So it's common, but there's other bugs. So it was kind of concerning that they can only study one source of infection. They only use these bottles shown, these 3 types of containers. If your container is scratched, bumped, dented, water doesn't refract correctly, so it's like useless. So I'm not sure about how careful with your water bottles as you are, but mine get banged and dented all the time. So you're gonna have to have some water bottle you keep like you baby.
Mine are covered in stickers. Does that matter?
Mine too. Mine. This is just one of my 3 that it's like completely coated. I would probably rely on this in a disaster if I was stranded overnight with no other source of water, but I don't think I'd rely on this for a through hike or even a day hike. Take the chance of 12 days later having giardia.
And the other problem is with the length of time it requires exposure, if you're at an optimum latitude, you still got to leave this out for hours and hours. So you're going to be, how many liters do you bring? How many can you rotate at a time? So you're going to have like 3 sets of bottles you're having to rotate for 2 days of exposure and 1 set to drink.
Yeah. So it's a cool trick to know if you're stuck without any other option, which is kind of why I included it in, because I think we can rip apart I shouldn't say rip apart the methods and limitations. This is sort of like a, hey, let's test to see if this is even feasible. And then somebody else, or maybe this group later on, will take it to the next step and then the step after that. But it's kind of like a foundation study. So I hope we'll see further work on this in the next couple of years. But I don't know
Maybe
if
if you're in a survival situation where you're like stuck on a desert island for a really long time and need to purify water, this would be your go-to.
Oh no, the lawnmower. I got to go inside.
We can't build a still out of coconuts.
I mean, there is that. And then there'll be the whole desalinization problem, which will require some more work.
Bear with me for a second. My neighbor chose 7:25 to do his last minute lawn mowing. Come on, son. I'll start the recording in just a second.
When else would you do lawn mowing? Come on.
6:30 after your sleepy self gets home from a night shift and your neighbor decides that now is the time for his unmuffled lawnmower to let loose.
All right. So I'm going to share my own screen for a second. All right. Can everybody see this presentation? Okay. So I believe he's way more tech savvy than me. I'm not even sure how he did this. So let me get this ready to play.
Hi everyone, my name is Luke Counterman. I'm a recent graduate from the Yale PA Online program and also a FOM candidate. So we're going to be talking about this article titled A Comparison of Bacterial Colony Forming Units in Water Bottles and Hydration Bags Among Outdoor Enthusiasts. It was published in the Journal of Wilderness and Environmental Medicine in 2009 by Brainard et al.
You just put it away.
So this study kind of focused on water transport, right? So for all of the outdoor activities that we participate in, most of the time, at least I carry water. So water itself is a common source for enteric illnesses. So there's a whole chain of events that go. So sorry. So this study kind of focused on water transport, right? So for...
What the heck?
Hi everyone, my name is Luke Counterman. I'm a recent graduate from the Yale PA Online program and also a FOM candidate. So we're going to be talking about this article titled A Comparison of Bacterial Colony Forming Units in Water Bottles and Hydration Bags Among Outdoor Enthusiasts. It was published in the Journal of Wilderness and Environmental Medicine in 2009. So this study kind of focused on water transport, right? So for all of the outdoor activities that we participate in, most of the time, at least I carry water. So water itself is a common source for enteric illnesses. So there's a whole chain of events that go into consuming water, like where the water comes from, how the water is treated, but then also how it's stored and how it's consumed. And that's not always a frequent target of studies. We focus a lot on, cleaning methods, filtration, chlorination, things like that. But also we need to consider that the containers that we're storing our water in could potentially be a source. So the authors concluded there are 2 primary means that people who participate in outdoor activities transport their water in, either a hydration bladder or a water bottle. And those are the 2 categories that they use throughout. They hypothesized that the differences in these 2 storage methods could potentially lead to an increased risk of contamination one versus the other. their key objective was to analyze the difference in colony forming units. So essentially how much bacteria grows from water samples from it. So their null hypothesis was that there was no significant difference in colony growth quantity between the two. So let's talk about the study design. So they went to 3 different trailheads and collected water from, just giving a sample of people who showed up who were willing to participate. And this was in Albuquerque, New Mexico. So they took samples using sterile technique directly from the water bottle. So they opened the container and took it from the inside. And for the hydration bladders, the same thing, they opened up the actual bladder and then pipetted from the bladder itself. It didn't go through the hose, didn't go through the nozzle, wasn't poured out, anything like that. So participants in this also completed a survey. In that survey, they listed their activity, how long they were going to be engaged in that activity, where the water originally came from, how long ago they filled the container, when was the container last cleaned, how long have they owned the container. So after the samples were taken, they were immediately refrigerated, transported to a lab, serial dilutions were carried out, and then they were plated on 5% sheep's blood agar. And then incubated for at 37 degrees Celsius Fahrenheit for 24 hours. And then they hand counted the number of bacterial forming units. So the results, they got a total of 67 samples, 33 water bottles, 34 hydration bladders, so pretty even there.
Dang it.
Hi everyone, my name is Luke Counterman.
Can anybody hear me? Sorry, every time I try and admit somebody or try and see the chat or anything, it pauses the video. So I'm like handicapped. So I'm trying. I'll replay and try and find where we were. But all I did was admit Francis here, and sorry about that.
So it wasn't poured out, anything like that. And pipetted free from the water bottle. So they opened the container and took it from the inside. And for the hydration bladders, the same thing, they opened up the actual bladder and then pipetted from the bladder itself. It didn't go through the hose, didn't go through the nozzle, wasn't poured out, anything like that. So participants in this also completed a survey. In that survey, they listed their activity, how long they were going to be engaged in that activity, where the water originally came from, how long ago they filled the container, when was the container last cleaned, how long have they owned the container. So after the samples were taken, they were immediately refrigerated, transported to a lab, serial dilutions were carried out, and then they were plated on 5% sheep's blood agar. And then incubated for at 37 degrees Celsius Fahrenheit for 24 hours. And then they hand counted the number of bacterial forming units. So the results, they got a total of 67 samples, 33 water bottles, 34 hydration bladders, so pretty even there. And they found no significant difference in the percentage of people who were cyclists versus hikers and runners, how long they were participating in their activity, whether it was municipal water versus well water or like a surface water, how long ago the container was filled, how old the container was, demographics. Essentially, they found no difference between the two groups except for whether they were using water bottles or using hydration bladders. So as far as the primary outcome came, they also saw no difference as far as the number of colony forming units between water bottles and hydration bladders with a P of 0.62. So some discussion about this article. So the study, it showed no significant difference in bacterial colony forming units, but I think we need to question whether that's actually valuable, and the authors do it in their discussion as well. Because colony forming units really isn't a good metric if our worry is about enteric illnesses, right? It's more what species are growing, right? So whether it's pathogenic or non-pathogenic, that would be more useful, but they didn't actually go through and do like a differential plating and determine the species of the bacterial colony forming units. Also, it was a pretty small sample size, only 67, and they were collecting straight from the container versus, you know, unlike a water bottle like this that has a nozzle, it's not through the nozzle. Same with like on a hydration bladder, it doesn't go through the hose. Their reasoning for that was that, you know, they could be contaminated with saliva and whatnot, but I feel like that's how we drink the water, so it makes a lot of sense to take it from there, but they didn't do that. They also didn't record what the containers were made of, so they just classified them either as hydration bladders or water bottles, but hydration bladders come in different types of plastic. Most of them are some kind of plastic, but so do water bottles. You know, you have like a soft plastic versus like a hard polycarbonate versus, you know, some like a soft water bottles that are essentially a hydration bladder with no hose, or like a metal water bottle, you know, something that's aluminum or steel. They didn't collect that information, and that could have potentially been useful. It could have been a source of difference. So they also note that I think it was like 90% of the water was municipal water, which in Albuquerque is chlorinated. So they thought that that probably impacted their results as well, because the chlorination was probably killing most of the bacteria that was in there anyways. And yeah, so the authors concluded that really based on this study, they can't recommend one solution for getting a water over the other, and to just use whatever you prefer, whatever is more convenient. And of course, they noted that in future studies, they would prefer to have larger sample size, identify the microbes, collect more information about the containers. And also they noted that this can't be applied to water that comes from natural sources, because the majority of the water was chlorinated in this study. So yeah, that's a little discussion about it. I'm not sure how useful or yeah, I don't know about this paper. I feel like it wasn't very helpful, but I think maybe some future better design studies might show some interesting differences between the two, but for right now, we don't know.
All right. Well, thanks for putting up with my lack of technical understanding. Luke is much more tech savvy than I. He helped me with all the registration forms and Google spreadsheets and stuff required to run this journal club. And I think this is an example of his understanding that I really lack. So thanks. So I'm glad he kind of ripped into this one, because he's right. The limitations are pretty high for this one. So it makes me somewhat more comfortable, I suppose, with my hydro flask that I use every single day. Although every time I'm outside hiking or backpacking or anything, I do rinse it with soap and water. I'm not sure if everybody does the same with their hydration pack. So it's kind of a thought-provoking study, at least to make you think, like, do I get out that little squeegee, like bristle thing and squeegee the little water tubing from this reservoir to the nozzle every time? Probably not. So it kind of shows that maybe it's not as contaminated as I like to think of my hydration pack, because I think it's kind of icky, but apparently not. So it'd be nice to go further with this study and actually test the tubing, maybe test the mouthpiece to see if it's actually stands up, sort of.
Maybe it's just me, but I've definitely had like the tubing like clearly has stuff growing in it. Typically, it's not actually enough to deter me from using it, because I feel like I'm scraping off the biofilm probably actually makes it worse than just drinking it and leaving the biofilm there. I don't know. So far, it's been okay.
So that's kind of the way I thought about this study. Is like, oh, it's probably fine. But there's definitely limitations. It'd be kind of see if they took this further, maybe different sites rather than 3 places just in one city in one county, you know.
Wonder did they say how often they were refilling their water bottle too? Like how long the water sat there? Because like my hydration pack for mountain biking sits in my car until it runs out of water, and then I put more water in it until it runs out of water again, which, you know, can be a couple weeks.
Yeah, I don't think they included they didn't ask people how often they cleaned it, when they last filled it, how old it is. So their questionnaire was kind of limited. It'd be kind of interesting to include a broader spectrum, or at least to document that.
How would one of you guys design something, do you think, that would be better? Do you even have any ideas?
A better study.
Yeah.
I think it would be better to actually look for the different types of bacteria in the water samples. And then also, it would be interesting to compare like a plastic bladder compared to a like metal hydro flask. Because I don't know, I feel like my hydro flask is a lot cleaner than my Nalgene. I definitely have like some serratia growing in the lid right now. But yeah, just like comparing maybe different material types, and then also a concern for like possibly like BPA leakage from the plastic water bottles, like especially if it's just sitting in the sun for a while, would be interesting.
So I'm kind of eating, but at the same time.
Definitely temperature could play a role in whether you're putting, you know, hot liquids in a container versus cool liquids, and what temperature, because, you know, a lot of people also use hydro flasks for coffee or hot chocolate or things like that. You wonder, you know, sometimes they look pretty nasty after they've had all that kind of stuff, or tea. And also looking at temperature, because a lot of times the temperature of your coffee is probably not quite enough to necessarily kill everything that's in there.
I think one of the questions that is brought up by this study is, sure, you can test for bacteria on any surface and probably grow it with alacrity from any surface. The question is your water bottle making you sick? I think that's actually the patient-oriented answer to the question. Like, are you going to get sick from this? Versus whether or not you can grow bacteria. So I don't know how you do it, but it would be an interesting study to test people to see if they get sick from their water bottles.
I feel like even if you could figure out what the baseline amount of each bacteria you would need to theoretically make someone sick or have toxic effects, and then you could measure, like, do colony counts or something like that. That might be a way to get around actually, you know, getting medical students to sign up for this project that we could do and get them sick.
You'll at least give them a day or two off of rotations afterwards. So yeah, I think there's a lot of ground to cover following both of these studies. That's part of why I chose them. I don't want to choose the perfect study every time. The point of a journal club is to learn and to critique, and to learn how to critique. So thought-provoking, but practice changing, maybe not. So the next thing, myself and the Georgia fellow, Aubrey, and my co-fellow, Alex, went on a trip in February. Part of our, I'll call it, assignment was to make some videos about different wilderness topics, including water disinfection. So we made fun little videos. I just want to show them real quick, kind of showing what we have used on our trip.
So we are here at this very tiny spring, and Alex is using a leaf to funnel water into his filtration pouch. A creative way to collect water from a small water source. So I filled up my bag from the spring. So how exactly do I filter it? I'm going to attach my filter like this, right?
Yep, so we're going to attach the filter to the bag, remembering that this bag and the contents on it are dirty water. We do not want any of this external water to drip into our bottle while we are filtering. And so it's very important that we have the bag and the filtration system off to the side, more so to the side, so it's not hanging over top. Yeah, like that. You're gonna shoot toward it. So you will spill some, but it's safer than getting contaminated water in your source. And the bag is very tough. You just roll it up from the bottom, like a tube of toothpaste, and give it a squeeze. And it will take several times of filling up the bag to fill your water.
Okay, so I'm going to add some iodine to my water. I've already filtered it, but the filter doesn't remove viruses. So the iodine will help take care of the viruses as well as bacteria and usually Giardia, but there's increasing Giardia resistance to iodine. So my iodine kit comes with 2 bottles. This one with the white cap, which is iodine, and then this one with the yellow cap, which you have to wait 30 minutes to add. And it helps remove some of the bad flavor of the iodine, but is optional. You don't need it. It doesn't make your water any cleaner. So to use the iodine, I pulled out 1 tab, and I'm going to actually pour some water into my cap and then add my iodine tab. And then I'm going to let it dissolve in this water a little bit. I'll even add a little more. And the reason for this is because we want the iodine to make sure that it gets into all of the grooves of the cap so that that water gets cleaned as well. And then now that I know that it's cleaned my cap, let it go into my water bottle. And the iodine itself, 1 tab is good for 1 liter of water. So it works great with your standard 1 liter bottle because you know that you're doing the right proportion. And then I'm just going to shake it up a little bit. I'm going to make sure I rinse the clean water around the cap before I drink out of it. And I have to let this sit for 20 minutes before I drink. The iodine is yellow. It'll stain your fingers and it will stain a clear water bottle or a clear reservoir.
Well, just some of the videos we made on the technique. Did anybody have any questions about what they showed or tips for improvement on technique?
The only one I would talk about with the iodine, I have Aquamirror with me. So sort of similar principle of, dissolving or mixing into your water, but I don't do the pour it in a cap and then pour it into the bottle method because I'm very liable to spill. But I just treat the water and then, put the Aquamirror in the water and then flip my bottle upside down, loosen the top enough to allow some water to spin through the threads, and then retighten, loosen, tighten, loosen, just to get water all the way through.
Yeah, basically either way to do it, you got to make sure you get what you're actually drinking from clean, or what's the point? So the methods or the items we actually use to filter, I want to show those real quick. I know there's other things, but just the 3 that we showed, and then I'll let other people show their stuff. Let me find mine. So this is, if you can see my screen, this is the Sawyer Micro. This is what they were using that kind of poured off the side. Yeah, Mini is slightly different. It's in the guidelines, it's kind of a different type of, it's like a new type of filter. They're using a hollow fiber mesh. So the surface area is far greater than like any other typical micro filter. And with that higher surface area, you're essentially getting the same, I think it's 0.1 micron size, but allowing for a higher flow rate. That's how they were filtering a liter in only losing about like 2 to 1. Usually you filter water and you're losing a ton, you're pumping there forever. So it's more efficient. It's tiny. So that one worked really well for the trip. I think they each have those and they both really like those options. This is the one I have. MSR Mini Works. It's a lot bulkier. It's a 0.2 micron, so technically this filtration size is slightly larger, 0.2 micron rather than 0.1. So what you do is you take the tubing like right there, and you stick that into a water source, and then you kind of use the pump handle over here, and you're just pumping the water from that tubing into the other tube that comes out the other side into your reservoir. So what I did is I took my water pack, put it in the water, got a couple liters in my dromedary bag, filtered from that into another water bag. Always make sure you have clearly designated pre-filter and post-filter bags or pouches of some kind. Don't mix those up, or you're gonna be in trouble. And then the third thing that was in the video was the Life Straw. I've used that as well. The company itself does great things. I don't think I'd rely on it for I'm going to use it for my trip, and that's the only thing I'm going to use. I keep it in my pack more of a, oh boy, something's going bad kind of thing. The pore size technically is just as good as the last filter at 0.2. For some reason, a lot of people think that this gets rid of viruses. Like, I don't know if it's their advertising or media or what, but a lot of people think Life Straw completely gets rid of viruses. Some of their products do, not this Life Straw pen. Drawbacks to this is you have to, if you saw that picture of me, you've got to get in the water. You're getting real close, and it takes a lot of force. So you got to suck on this really hard to actually get water through it. Is it I kind of think of it as a backup if my other two techniques fail. It's like a last resort thing. And then Anne was just talking about the liquid chlorine or iodine. They both have both. This one is actually more highly recommended by the WMS because it's exactly this exact number of drops per liter. And it's not if you have the little tabs, they could get chipped or broken or something like that. So drops, you're not going to mess it up unless you mess up your count, I suppose. And here's the tablet version of them. Don't take this as any brand advertisement. These are just the things I've used before. And then you can't go wrong with just some heat. If you boil something, you'll kill everything. So it's bulky, it's heavy. You need your fuel, you need your source, and you need a container. It's bulky, but you're going to get everything. UV is cool. I don't know. It looks like somebody's waving a magic wand when they're doing it when I use it. So it's kind of like a trick. Oh, is it really doing anything? But that's how they filter rooms post-COVID patients. So I guess it works. I'd recommend always having at least two methods, one after the other to use. Don't rely on just one. Because let's say you use heat, there's still going to be dirt and sediment and stuff like that in it. So any other things you want to show off? Or any specific techniques you've used that have worked or maybe not worked? Yeah, that's how you're ready.
Complete my Aquamira, but it's very small. The A and B don't really matter. You're putting them in at the same time. I don't know, maybe all of you use Aquamira and love this, but I like it. It's light and fast, doesn't require you to carry a lot of equipment. You get to bring some extra duct tape if you just stick them together. And then the picture that was just shown was with separate dropper tops. These are soft plastic, and then there's just a little tip at the end that controls your drop size. You drop them right into the little cap, let it sit for whatever, 20-ish minutes. I kind of round on my numbers, and if the water feels a little dirty, double it. If it's a little colder, let it go longer. But yeah, this is admittedly almost exclusively what I use, just because I don't like to carry a big, heavy filtration system most of the time.
And I think that's a strong point to retouch on. So chlorine, you need to protect it from the sun. We've already talked about that. It breaks down the chemical process, basically. You need to keep it in there long enough. If the water is real cold, your duration is going to have to be longer, or you need more amount of the chemical, which then you get to probably not toxicity levels, but it's going to taste bad. So then you can either use charcoal or ascorbic acid, or the little tablets that come with your iodine to counteract the taste. But why not just do a little flocculation, coagulation, or a little badana filtration or something to get rid of the sediment first? So again, it depends on your source. If you're by a farm maybe just drink water you brought in. If you're in the middle of nowhere, bring stuff that, one, you can carry, two, that you rely on and you know how to use. But I'd tell you at least 2 sources are kind of like recommended. Any other thoughts, tips?
When dealing with really water that has a lot of sediment and stuff, sometimes putting a coffee filter or some kind of cloth over the intake filter for a mechanical pump helps keep it from getting all gunked up.
Yeah, we ran into that with the Life Straw, and luckily all you got to do is pull it out of the water and just kind of wipe it off a little bit. For all the other filters, if it gets basically after every use, if it comes with the technique to kind of backflow the current, that way it blows out all the stuff that's stuck to the filter on the pre-filter side. Make sure you do that like after every use, because if it overloads the pre-filter side, it takes higher pressures to force against that, and it's going to start like breaking down the ability to stop bacteria and protozoa to get through. So they actually will be forced through by the higher pressure. So make sure you clean it like every time. Backflow. If it's the type of filter that can be backflowed, backflow it every time. Again, don't mix up your 2 pre and post filtration sources. So I think that's it. It's pretty much for content, unless anybody has any tips or questions.
Other cool chemical treatment is Polar Pure. It's this sort of, let's see if I turn my video on, if you guys can see my phone. Maybe not. Let's see.
See the peaks of otter.
Yeah, hold on. Let's see. All right, now you get where I actually am. And so it's called Polar Pure, and it's like this brown bottle, and it has super saturated iodine in it. So you put a little bit of water in there and kind of swish it around, and it creates more or less drops that you can use, but it lasts forever. Daniel still has one from when he was in high school that still has the crystals in it to be able to keep making it. So it's nice if you're going on a long trip and you're afraid of like running out of something, you can basically continue to replenish it forever by just adding more water. They stopped making it for a while, but it looks like it's on Amazon again. And I typically kind of think about where I'm going when I think about what kind of purification I'm going to need, kind of like what Justin said, especially when you're traveling abroad. A lot of places where you can't drink water, it's due to concern for viral contamination. So if you're not buying drinking water to like brush your teeth and stuff, using your SteriPen or something that'll kill viruses is a good idea kind of traveling abroad. So a lot of times on those trips, even when you're going to be in a more urban area, having some sort of water treatment with you is a good idea.
I'd say the one last thing that kind of goes along with water disinfection is if you're not washing your hands correctly, what's the point? So whether you're going to, this is like camp safe, it breaks down, it doesn't hurt the environment soap. Make sure you wash your hands or frequently on the trip, or else you're just going to get contaminated from other personnel sources. So I'm going to end recording. I think that's about it for the water disinfection portion.